Hello, everyone. Can we have a round of applause again for this? So I came into this COVID hotel project kind of in the middle of things, and something that I realized really quickly is that everything that this project is trying to do is inspired by the people who worked in the QI sites and who really had a lot of insights on the way that the system maybe hadn't been working for them and the way that they really felt that it needed to change. And so I think that part of the intention of the project here, the reason we're doing these panel conversations as part of the performance, is to continue to hear from people who are working on the front lines and who are really working on changing the system or working within the system in ways that are making it more functional and more accessible for everyone. So I have with me today, and I'm just going to read from the program because I don't trust my memory. I have Anthony Ruffin here, who is a staff analyst at the Los Angeles County Department of Health Services in the Harm Reduction Division. I have Dr. Ryan J. Smith, who is the president and CEO of St. Joseph Center. And I have Becky Dennison, who is the co-executive director of Venice Community Housing. Let's welcome these three. So I'm going to ask you each to start by just saying a little bit about who you are, what you're doing now, and the path that led you to what you're doing now. If you want to start us, Anthony.
I'll start. So my name is Anthony Ruffin. I work for the Department of Health Services now. I'm currently on a project in Skid Row called the Care Campus project on Skid Row. Now I'll be down there 7 days a week doing that work. I currently work on Skid Row, walk Skid Row daily, every day. No matter if it's raining or not, it doesn't matter to me. What drove me to this work? My father was homeless on Skid Row from 1984 until when he passed. He had a stroke in front of the nickel, and he passed away. My stepmom was homeless on Skid Row from 1968 till 2013 or 14, where she passed away on 5th in spring in her apartment, a little tiny little unit. Some of you guys might know them. They called her Spare Change. That was my stepmom down there on Skid Row. That what drove me to the work, and Skid Row is the place I like to be. Yeah.
Thank you.
Hey everyone. First of all, that was amazing. That was really, really fantastic, and I really believe and the power of art to bring light to social issues. So another round of applause for our amazing performers. Yeah, of course. My name is Ryan Smith. I serve as the president and CEO of the St. Joseph Center, an organization that has been working to end homelessness and uplift people out of poverty for nearly 50 years. Started here on the west side by some radical sisters, and when I'm saying sisters, these are nuns, even though sisters, and started on a storefront, and now we support 15,000 people across LA County. We work on the west side, but we have offices in South Los Angeles as well as in downtown in Skid Row. In fact, we support 2 permanent supportive housing sites in Skid Row, Cobb and Rainbow, which are close to each other. I came to this work, really, a lot of my work has been around policy, advocacy, and systems change. But I was a little boy in Culver City. My mom spent her life savings to move to Culver City because she heard the schools were good and were graduating young black men, and she did everything possible for 10 years for us to stay there until one day we couldn't afford it. And the home that we had made for 10 years, we had to vacate in 10 hours. And she handed me trash bags and said, "We have to go." And if it wasn't for my mother knocking on neighbors' doors and basically saying, "Hey, can we sleep in your living room so that my son can finish high school?" and if it wasn't for my college counselors and my principal who paid for my college application to go to UCLA, I may not have went to UCLA 3 times over and been in front of you today. So I really believe in compassionate care and continuums of care, and I'm a living testament to that work. And I work alongside an amazing group of staff members, 400 of them. 54% of them are identified as Black, 25% of them identify as Latinx. Happy Black History Month. And I do have to shout out frontline worker LaShawn Preston, who is here from St. Joseph's Center. She's dedicated her life to end homelessness every day.
Hi, everybody. I'm Becky, Dennison. I work with Venice Community Housing. Nice to be back with the Poverty Department. I haven't been to a performance in longer than I should say, but I've been to many, many, many. Let's see, where to go after these stories. Venice Community Housing develops and operates supportive and affordable housing here on the west side. We have about 350 homes that are providing permanent, stable, supportive housing to folks who have experienced homelessness and some who have not experienced homelessness but are extremely and very low income. We're expanding, actually. Our new site is about to break ground right around the corner on 20th and Colorado. We'll get into it, I'm sure, but I worked in Skid Row for 20 years prior, so Anthony and I have some shared history and shared friends. The West Side is a different place to try to build housing and respite centers and all the things that maybe we're going to talk about today. I came to the work, I actually don't generally tell my personal story. That's framed in obviously some white privilege and in a different city, but I come from a family with extreme circumstances of family violence and mental health and substance use, and I come from a large family who believes in compassionate care as well. So when I got to Los Angeles, I felt like I had known some folks in Skid Row. I was working for LA County actually, and I thought, I sort of, once you're in that neighborhood, once you know it exists, we used to say this at LA Can, once you know a problem exists, you're duty bound to try to help change that, and so I worked on those streets for a long time, and now trying to do, I believe from that work and from everything I've done that I need to focus my time on permanent housing because there's so little, but I have worked in access centers and respite centers and things like that, and they're incredibly important as well, but I focus most of my time on the permanent back-end solution.
We need that.
All right, so I'm going to pick up right from what you were saying, Becky, because I think that's a great place to start. This group comes from Skid Row, and a lot of the things that we heard about in the performance are Skid Row specific. So I know, Anthony, that you're very familiar with what's happening on Skid Row with the Care Campus right now, if you want to share a little bit about that. And then I'm also curious to hear from all three of you the other neighborhoods that you've worked in or that you're familiar with in this city and how they might be different than Skid Row, how they might be functioning differently or have different challenges to them. But I would love if you started by talking about the Care Campus, Anthony.
Yeah, I will say this first. I've been working in the streets nonstop since 2008, and I've worked everywhere in this county on the streets, from Lancaster all the way to San Pedro. I also done work in Santa Monica, in Venice, and everywhere else on the streets. And Skid Row is just where I choose to do my work at now. Skid Row, the Care Campus, well, I would say this. It came out of Selena's, board member Selena's. She wrote a letter basically to Skid Row apologizing for the way LA County treated Skid Row, primarily minorities in Skid Row. And that's where this really came out of. And she wanted a comprehensive report from the community about Skid Row. And I was telling you earlier, and I was telling her earlier, one of the first things I heard in one of these meetings with the community and with the service providers on Skid Row, a lady said this, and I quote, "This is the first time that we get to meet with our abusers. And everybody in the room got quiet, right? And that was the beginning of the healing between these community services and the people that live on Skid Row. And I think this went on for like maybe a year, 15 months, where there was these meetings with the residents of Skid Row, some homeless, some living in units, and it was contagious in those meetings. And I won't lie to you, and to be honest with you, it should have been that way. It should have been contagious. It should have been not a lot of trust with the service providers. It should have been a lot of that stuff that went on that had to happen. And what came out of that is the Care Campus. The community wanted ambassadors hired from the Skid Row community. They wanted case managers hired from the Skid Row community. They wanted economic opportunities for the people on Skid Row. They wanted a lot of things. And for the first time, I think the county delivered on that promise when they built this campus. Some people have seen the campus. It's a beautiful campus. It's a low barrier campus. It's a harm reduction campus. It's respite beds on this campus. It's medical services on this campus. It's a place where you can wash your clothes on this campus. It's extended hours to 7 days a week with services there. It's a park on this campus. It's a stage on this campus. And we got 3 beautiful service providers that's going to do the work on this campus that are known in this community for decades. And have a long-standing relationship with the residents of Skid Row. And I'm very, very proud of that. And I'll be there because I was at the Vagabond, and we're going to run it just like we ran the Vagabond. Come in, get what you need, and let's get it over with. Let's go. And I think that's what it needs to happen on Skid Row.
And for those who don't know, the Vagabond was one of the COVID hotels.
It's the COVID hotel they was just talking about. I was the guy from South LA in there.
Right.
Doing all the so we're gonna run it just like that. I'm happy about it.
So we work predominantly on the west side, and as I mentioned, we have offices in South LA. I will say we have dynamic outreach workers who are going out day in and day out to provide services and resources. Many of them are community ambassadors, they're LVNs, they're registered nurses, they are mental health therapists who are coming to bring people inside. And we see that work. I just want to shout them out, even during the wildfires, especially during the wildfires. They went out to make sure that folks experiencing homelessness have what they need. That's amazing. I will say the challenge is when you have an outreach team, their job is to help bring people inside and the throughput to permanent housing. And on the west side, where we are right now, we have a deficit of beds. So it doesn't matter how many outreach workers we have, if we can't bring them to a place where folks can actually, whether it's interim or have permanent supportive housing, is a challenge. And I say that because as much as I love the West Side, I grew up in Culver City. Our communities on this, in this community have fought very hard. Many people have fought hard against having more shelters and more permanent supportive housing sites. In fact, I want to say Becky has been a champion to make sure that we bring permanent supportive housing and has seen the challenges that happens, particularly in this community. So we have work to do on the west side. We certainly have work to do on the west side to do that. In fact, we just had a shelter closed down, a Bridge Home. So we are now at a deficit of beds. So a lot of our permanent supportive housing sites are actually in South Los Angeles, in Skid Row. So we're taking folks who would say this is their community and placing them in other communities so that they have a place to call home. I will say in Los Angeles, as you all mentioned, temporary housing in the play, we have seen the explosion of interim housing. Both congregate shelters, but also because of the mayor's initiative Inside Safe, a lot more interim housing at motels. We actually run 12 interim housing sites. 10 of those right now are at motels across LA County. And all of that work's important, but we want to make sure we have the wraparound supports in interim housing the way we talk about permanent supportive housing. so that you have SUD, you have substance use disorder counselors, you have mental health professionals, and we haven't done that work enough yet, so we have work to do. Also, we need to build more permanent supportive housing. If anything I say tonight, remember this, we need to build more permanent supportive housing. We cannot have folks languish in interim housing for 2 or 3 years.
No.
That is not the goal. The goal is 6 months, but there are folks who have been in interim housing because we have not built enough permanent supportive housing quickly. We're building it, but we haven't built it enough. So the work that folks like Becky champion is really important. Hopefully that's a good segue. I was trying to give you that segue.
I can't remember what the question is. What's the question again?
The question is how
Different
is
communities.
Skid Row functioning and how
I
are
see.
the different communities
I see.
worked in?
Okay. I can't speak to how Skid Row is functioning anymore, unfortunately. I have been gone for 9 years, although I visit quite often. But but I will talk a little bit about the drastic differences. I mean, Skid Row has probably the most challenges in terms of disinvestment and lack of resources than any community in the city. It is also one of the most beautiful and connected and compassionate and caring communities that I've ever spent time in. That is not how I feel about the West Side as a whole. And it's not that there are not pockets of that within the West Side. There 100% are. There's some amazing mutual aid groups. There's some amazing street-based communities. There's interim housing communities that feel, but they're disparate versus like geographically. So we've not been able to like gather as much of that solidarity and sort of collective voice, I think, on the West Side. And quite frankly, the loudest voices are, I believe, a minority of folks who are pretty hateful and pretty awful towards unhoused people and toward any piece of the solution, whether it be a respite center, an interim housing site, a permanent housing site. So I often say, like, you can't complain about a problem over and over again and then oppose every solution to that problem.
Right.
But that, unfortunately, is the case in a large majority of the West Side communities. And so our goal is really to gather folks like you, because every time we go door to door, every time we're out in community, there are far more people who care about their neighbors who are living on the streets, who know folks by name, who are sort of living out what we saw in the COVID hotel just now, but sort of being silenced and or overwhelmed by this NIMBY voice, or what I have said, and people get mad, is a segregationist voice in terms of sort of anywhere but here. And people are real happy. So like, for example, our Inside Safe sites, -1, there was 130-something people in Venice who were moved into hotels under Inside Safe. About 20 of them were in a local hotel, and everyone else moved to South Central or Pico Union. And that's then where they will be permanently housed. So sort of taken from their home neighborhoods with lots of connections. We have an incredible healthcare system on the West Side, particularly with Venice Family Clinic. They're not the only ones. We have amazing street-based medicine. And so we see this like where we're able to get housing sited. Like I said, we've got 350 units. We opened 100 units on this side of town in the last year. I don't think that's ever happened in the history of the 11th Council District, unfortunately, because it's like a very drop in the bucket. And we've, like I said, 80 that are going under construction under here. But that's what we see, is that if you want to be housed, you have to move to a completely different part of the city. And then people lose their longtime connections, their connection to healthcare, their connection, and have to start all over again I think it was Tom in the play and others who, sort of in every neighborhood, we have to push for that. We cannot just take the path of least resistance. Because people are not all going to move into 2 or 3 neighborhoods in Los Angeles. Right. People care about the neighborhood they come from and are connected to.
So I'm going to ask as a follow-up question then, because I think I really like this idea that you're putting out there, that it's really a minority of voices who are against this happening in every neighborhood. And so what can the majority of voices do to make it clear that this is something that we want to fight for this more? I mean, what would be helpful for you at Venice Community Housing?
is to, you know, I think because, first of all, care for people, right? And people see people caring for people, and that sort of helps people to understand that folks can connect with people in their community and set that example. But unfortunately, it takes a lot of work. It means people have to be at neighborhood council meetings, they have to be at other community meetings, they have to be emailing and calling their council member all the time. They have to be jamming up Mayor Bass pretty significantly. Mayor Bass has been really, really bad on this, getting sites into every neighborhood. And we have to uplift elected officials who are saying yes, 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 and it takes continuous work because the opposition does continuous work. They are just sort of like, what are we saying that Trump is doing? There you go, right? And the opponents have flooded the zone. If you read any news article about any housing site, and particularly on the west side, the Midvale interim housing site, those, right, all the voices are people who oppose. So we need people to be far more active, far more vocal, be sending those emails, get out, and at the same time, spending time caring for neighbors so that people have that personal connection. It makes the voice more valid and authentic.
Thank you. I want to kind of go micro for a minute because there are some terms that I think we've been using a lot that we even have defined really basically in the program, but I think that hearing from experts on how they're used on a daily basis is really helpful. So what I'm thinking about are harm reduction is a term that we've heard several times here and that I think everybody has heard at least tangentially probably, but it's helpful to know how it works in practice. And then I was also hearing something about wraparound care, and I think I heard trauma-informed thrown in there. And I think both of these, you know, when you're in the field, they're used really frequently, and yet they have theory behind them, and they have kind of a larger concept behind them that I think is useful to unpack for those who want to get more deeply involved and who want to understand the process. So I'm going to ask any one of you if you want to pick up one of those terms. I'm sorry, I know that harm reduction is kind of your specialty, Anthony, and if any of you want to pick up from there.
I would say harm reduction is used by all of us.
Yeah.
When you get on your car, you get in a car, you put on a seatbelt, you're practicing harm reduction, right? Harm reduction is used in so many different ways. We all use it, right? And for me, harm reduction is, and it was talking about it here when we were doing at the Vagabond, right? Meeting people where they're at, understanding what people are doing. I don't like to use the word client. I don't like that word at all, because I don't see nobody as my client. It's a human being, right? That's where I start at with it, right? And like I was telling you earlier, nobody's never asked me to fix them. They've asked me to help them, right? So I'm not into fixing people, I'm into helping people, right? That's not my job to fix people. And I don't too much care if they use it, how do they use safely, right? If they ask me about it, I'll tell them about it, but they don't ask me, I don't, right? I don't do that, right? How do people use safely? How do sex workers keep their bodies healthy, right? Are there condoms available? Is this stuff available to them, right? Right? Housing, we hear so much about housing, but do we talk about appropriate housing? What's appropriate for this person, right? Everybody throws out the word housing, but I would like to use the word appropriate housing based on your needs. That's harm reduction, right? Trying to navigate this system so you don't have to sit in that shelter a year or 2 years. That's harm reduction, right? That's trauma-informed care. That's how I look at it. So harm reduction has a lot of different issues, a lot of different stuff. Somebody may inject it. What size needle do they use? Right? Right? Are they using safely? Harm reduction. If you're using, can you use with 2 or 3 other people so nobody overdoses? Do you know how to use naloxone? Do you know how to do the breathing stuff to keep somebody alive? That's harm reduction. It's keeping people healthy. I think we did it through COVID when they had all of the lunches out there for everybody to eat on. That was harm reduction, right? What we did in the Vagabond, that was all around harm reduction, right? So it's just this overwhelming philosophy that's just flowing through social services with compassion. These are not clients, they're people. These are not your clients. These are people. And they get to decide who they want to work with and who they don't want to work with. It's their choice. The CES, I believe in harm reduction around that. When I'm working with people, I let them see their score, let them see the notes. It's their information. That's harm reduction. Because they have an understanding of how this system works. They know what needs to be done in the system. They know why they got kicked out the other shelter. They know this stuff. Instead of me sitting back looking at this stuff, well, you got kicked out of the shelter because of this, 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 and this, and I won't show them the information. For me, I'm going to show you. It's harm reduction. I don't have a work phone. I have a personal phone. I think I got 1,300 contacts.
I know, that's right.
That's harm reduction. You got access to that 24/7, 7 days a week.
That's right.
That's harm reduction. My phone don't turn off at 5 o'clock. Call me when you're in a crisis. Harm reduction. I tell people all the time, it's your job to bother me. That's your job. Do your job. Harm reduction. So it can manifest in any type of way.
Yeah.
That's how I look at it.
Yeah.
Wow.
I just have to say, that's the most poetic
That-
definition of harm reduction I have ever heard, because you're in the work, so I appreciate that. I appreciate that. You can say as much as you like.
I know Dr. Heidi, I know Dr. Emily Thomas, I know Tina Jackson, I know all of these people, that big wig people. I got their phone number. Don't give me your number if you don't think I'm gonna hand out your number. Right? So I'm gonna call them right in front of you. Hey, Dr. Thomas. That's harm reduction.
I appreciate that. Maybe I'll try to build on that, on the maybe wraparound permanent supportive housing piece on that. So we've heard about PCH, permanent supportive housing. Actually, we talk a lot about downstream. I just want to talk systemically upstream a little bit. It's Black History Month, so when we talk about why we see the continued levels of homelessness that we see, we're remiss not to talk about race. We have to understand that 8% of our county is Black, but almost a third of the people who are living outside are Black.
Yes.
And there's a high concentration of Black people, particularly in Skid Row. And that's important because we talk about ending homelessness, we have to talk about the systems that have been in place that actually have fed into homelessness.
Yes.
And if we can't just talk downstream.
Exactly.
We have to talk upstream. So when Becky's talking about going there in the neighborhood, we have to remind people that these systems were not built and designed for people to thrive.
Yeah.
So we have to dismantle systems while we build up systems.
Yeah.
And that's the job that we have to do.
Yeah.
Now, on that, part of that work is thinking about permanent supportive housing. So, I heard you say low barrier. Our job, we believe in housing first. We want to get as many people inside as possible. But housing first is not housing only. In order for people to thrive inside, they need all the resources necessary for them to continue to sustain themselves inside. So Rainbow, which is one of our permanent supportive housing sites, each person there has a caseworker who is following up with them. In fact, we're the intensive case management support, ICMS, lead. We're the social services lead, where we're providing caseworkers, social workers who are working with them daily. At Rainbow, they also have someone who just does this amazing community programming, because we know that communities are built. So they're talking about how we bring in produce, and they actually have a market that comes every what do we call those markets?
Farmers market.
Farmers markets. There's a farmers market that comes every week inside of Rainbow, so that people are able to provide fresh produce. And we have a program coordinator who is bringing in programming inside. They actually have a community garden on the roof in downtown, so that when they go and they see the amazing skyline, they're also building community there. We make sure that there are medical services that are provided inside of Cobb. So once again, it's not just housing, it's making sure, Rainbow and Cobb, it's not just housing, it's making sure we have all the wraparound services, everything that is brought to our residents so they can thrive inside. And we believe in permanent supportive housing, and it's been a model that has proven to be evidence-based and to work really well. And I was just hanging out with one of our permanent supportive housing clients. He was incarcerated for a number of years, and we know that folks who are likely to be incarcerated are likely to fall into homelessness, and it's a vicious cycle for a number of reasons. But he came to me and said, you know what, and he's from Jamaica, he was like, you know, I know y'all gave us this little small garden up there, but I actually turned the whole courtyard into a garden. He showed me where he is cultivating cucumbers and peppers and all of that stuff, and he said, this is my home. And that's the real goal, is to make sure that we're creating homes for folks and communities for folks within the homes that they're in.
And that's part of wraparound.
That's part of the wraparound services and permanent supportive housing, yes.
Yes.
That's cool.
But I'll just say, it's amazing that these concepts and the implementation of these concepts are way more widespread than they once were.
Yeah.
But they're not new.
No.
Any of you're talking about the Cobb, right? The Cobb is named after Charles Cobb, who worked on Fifth and Main for a long time, right? Like, he was just doing harm reduction as a human being and teaching all of us young people to do that, right?
Yeah.
And, you know, there's other folks throughout the time, right? Like this idea of housing first being a new concept. It's like if you've ever asked any unhoused person what do they need right away, it's housing, right? Like it's they're not asking for all the other things. They will ask for those things and need those things. So it does feel like we have taken some leaps forward, that those now are terms, but there is still a long way to go to implementing those and people personalizing them in the way that Anthony described and holding people accountable to that. And it's also really hard work. So the reflection on the turnover, that's real, and it impacts folks' lives every single day. So we've got to figure out how we care for people who do this work as well as the folks they're working with. And we've got more work to do. The systems that folks know have harmed folks, the criminal injustice system, the education system, right? Well, our system has done harm as well. And so we also have to undo that harm, and some of the trauma we're dealing with is trauma that has happened to folks in our own system of care. And that can be hard to face and then undo.
And she's absolutely right about that harm reduction approach. That approach came out of the AIDS epidemic. That approach came out of people using during the AIDS epidemic. So it's nothing new when you hear that whatever it takes. That came out of the AIDS epidemic. The Black Panther Party in the communities helping transgender women. A lot of people don't know that, right? That's all of this stuff. It's nothing new, right? And this is grassroots stuff that kind of came into social services, right? And it came out of the AIDS epidemic, Housing Works in New York, right? And all of these other places that started housing first. Because people were in hospitals with AIDS, there was nowhere to put them, so they put them in apartments. So that's where this movement really came out of. So a little background. So you're absolutely right.
I'm so glad that you're both pointing that out too, that there's a grassroots history to these things, because one of the reasons I think it's important to unpack these terms is they sound very clinical sometimes to someone who's not using them regularly. You know, I think sometimes can make it less accessible to understand the system, and even though they're very good things that are important, and so I think that that's so helpful to also remember that these are things that people came up with because they're natural, compassionate human things that are important to do. Yeah, thank you. So I'm going to ask one more question, and then we'll hear from the audience on some questions. But what I'm really reflecting on as I hear the three of you speak, and right after the performance, is we heard in the performance the idea that crisis creates opportunities, right? And we really are, I would say, in multiple crises in LA right now, and especially the unhoused community is undergoing multiple simultaneous crises. So, I mean, maybe this is like a broad scope question, but I'm wondering, where are the opportunities right now to change things or shake things up? You know, where can we go?
Yeah, that's a good question.
Big question.
As a person that's on the ground, for me, you've always been in a crisis,
Yeah.
as far as I'm concerned. We've always been in a housing shortage, a poverty issue for a very long time. We've always been in this. There's always been a low income, equality, redlining, and everything else going on across this country for a very, very long time. So it's always been a crisis as far as I'm concerned. Today in LA, it's a crisis because our system is so much bureaucracy in our system. It's 88 different cities in Los Angeles County, and each city has its own policies, the way they're going to deal with people living on the streets. You got police acting one way. Now police don't want to put hands on people that are psychotic walking in the streets and show some compassion and help them out. They don't want to do that no more. You got so much stuff going on in LA that is just, it's crazy to me. You got NIMBYism in LA where people don't want supportive housing in their communities and all of this other stuff. She was talking about it. You got all of that stuff going on. And people just need help, right? And what I try to do is I'm an expert at navigating systems. That's what I do. I don't want to be a social worker. I don't want to be a clinician. I want to be an expert at navigating this super complex system to make it work for you.
Right.
To make it work for you. Right? So I'm more concerned with the individual making the system work for you and navigating the system for you. Right? Because a lot of the times it's not what you know, it's who you know.
That's right.
I hate to say that, but it's the truth.
Yeah.
What you know is who you know. And they make the system move for you. If you're young and inexperienced in social services and you're on the ground, you got a lot to learn. If you're a young clinician coming into this, you got a lot to learn. You got a lot to learn. So it's just learning this system and showing compassion within the system and have faith that the people that come to work are not coming to work to say no.
That part.
Because our system is so fragile, all it takes is one person to say no.
That's it.
That's all it takes. One case manager, one housing navigator, one outreach worker, which you just talked about. Somebody quits, don't do the notes, the notes are not in there. That's all it takes. And just understanding that and making the system work for you. I think it's 25 matchers in the county. Each city has its own matcher. Each program, each organization has its own matcher. Nobody knows the matchers. I do. I know all 25 of them. And just navigating this system. There's so many policies that are at the top and the way they come to the ground. And we got this Zoom meetings. Nobody really knows each other no more.
Exactly.
That's what's wrong with our system. People are bogged down in Zoom meetings and stuff like that. And we don't know each other no more like it used to be in social services. I come from up under Molly Laurie. A lot of you guys know Molly Laurie. I come from up under her. Well, we work the streets to 8 o'clock at night.
Yeah.
We knock on doors. We make sure people safe. She didn't have a company phone. She had her own cell phone, so she taught me that. She taught me how to navigate this bureaucracy. And we got all of these trainings, but we don't have a navigation training. We don't have a CES navigation training. They were talking about it today. Put your bag up, put your bag up. No, my case managers know when they work for me, they can't come outside. Why can't you step outside?
Yeah.
What's wrong with you stepping outside? That's your job. Do your job. If you're scared of the population you're working with, you should be in the working in this population.
Thank you.
Straight up.
That's right.
This ain't the job for you.
That's right.
Right? So it's a complex situation, it's a crisis, but we also need people in this system that want to come to work and work for you. That want to work for you and push this system forward. Because I'm not the driver of the system. I like to work with a challenging person because they're going to drive the system forward. They're going to find the flaws in the system, not me. But I'm going to point them out. And that's what's going to happen on Skid Row at their care campus. They can have all these plans all they want to, how it's going to work. But the people that come on that campus, they're going to drive the services.
Yeah.
Yes, that's for sure. Yeah, that's true.
And that's just the way it is. That's just the way it is. And I love social services, and I love all the people in social services. I love all of the top people. I love all of the people that work in permanent supportive housing because we need that. They're way more important than me because they're behind the scenes. You don't get to see them. They don't do interviews, and they ain't in photo ops and all of this stuff. They're too busy trying to drive the system forward and make it easier for me to do my job. And that's what I like about social services, to be honest with you. It's a very small community of a lot of dedicated people from all type of backgrounds. It doesn't matter if it's the West Side or Skid Row. They're doing the same work. They're on the same meetings, and they're dealing with the same bureaucracy. She said it best. Karen Bass is not doing enough. She's not the only one that feels that way. So I do it with a passion, and I do it with a love. Because I come from prison. I come from prison. I've been shot 3 times. I've had an aneurysm. My house just burned down in Altadena. But I got a different perspective about life. My situation is temporary. The people on Skid Row's situation is permanent. I'm coming from privilege. And I know it. And that's just my approach to this whole game I want in social services. And I won't stop until it's time to stop. So that's just me from the ground level. When I look at social services in this crisis, we're going to continue to be in a crisis.
Yeah.
But can these people come to work and work for you and understand this system? I think more service providers need to start teaching that. System navigation specialists. That's what they need to start doing. So, yeah.
It's hard to follow up.
That was a lot.
I'll try. First, I want to say I'm sorry to hear about your home.
Oh, don't worry about that. Yeah, don't worry about that.
There are a number of folks who I know are dealing with the impact of the wildfires. But I will, maybe I'll build on that to say there are crises that, we've talked about providing opportunities. You never see systems get dismantled quicker than when rich people actually are impacted by those systems.
Yes.
Systems that have been around for 30 years that people said you can never change
Yes.
until somebody who has money has said, wait a minute,
is happening to me.
This is happening to me now.
Yep.
Yes.
And you see those systems fall like the next day.
Mhm.
I say that because we're about to have the most significant rebuilding discussion we've ever had
Yes.
in this city's history.
Yes.
And usually, the last time we had a rebuilding conversation, we were talking about the uprisings in South LA,
Yeah.
and we saw the bureaucracy and red tape that happened there.
Yeah.
But never have we seen whole-scale rich communities
Yeah.
that have fallen.
Yeah.
And let me tell you, those systems, that red tape that we've been talking about, how hard it's been to build, that is hopefully, but I'm sure it's gonna happen, is about to fall through.
It did.
But the problem is, will that just be, to Becky's point, a segregationist conversation?
Yeah,
Yes.
exactly.
Yes.
Yeah.
We are talking about how rapidly to rebuild in those hills. And yet folks in Altadena and other places are not actually beneficiaries. So
Yeah.
this is the time to call out the contradiction
Yeah.
of our systems.
Yeah.
Oh wait, you can build quickly here, but you can't build quickly there?
Yeah.
There's never been a tale of two cities that are going to be there very quickly in people's faces than what's going to happen.
Yeah.
So the opportunity is to actually show how the city can be very contradictory. That actually, well, number one, if you're having the conversation over there, you have to have it here. And not only that, we've been trying to have a building conversation for people experiencing homelessness for the last 30 years.
Decades, yeah.
So if they're gonna get theirs, then we're gonna get ours too. Or at least have the conversation about why not. So I do think there's an opportunity not only to shout out the contradictions of systems, but also to make sure that the systems are just for everybody.
Yeah.
And that you can cut red tape over there, you can cut it in every community.
Yeah.
It's also a conversation, once again, to remind folks that, in order for LA to be great, it has to be racially just. It has to be racially just, it has to be socially just, it has to happen in every community. So I think that's the opportunity. Now, I'm thinking about constitutional crises. I mean, we talk about the federal level, and not only that, the county is actually cutting $62 million from homeless services right now.
Yes, they are.
Even though Measure A just passed, doubling revenue to address this issue, they're saying there's a structural deficit, and they're cutting $62 million out of next year's budget. Yeah. So there's going to be a lot of discussion on how the city moves forward, and I think there's an opportunity to remind and see what we really stand for, what are the real values of the city. So,
Yeah.
Yeah.
I agree with both those things wholeheartedly. I think I was gonna speak a little to the fires as well, but I also just will throw in, with the World Cup and the Olympics coming, right? There's gonna be billions of dollars spent on fire recovery and those two things that will have no equity lens unless there is an uprising of Angelinos talking about equity and where those resources go and how they get spent. So I do think, separate from the crisis at the federal level, and pointing out those contradictions in terms of the crisis we have had, right? We've had far more folks without homes prior to the fires than only just lost homes, which is not to take away from that piece, but it is to say, if we can raise $500 billion in a couple of weeks, then we can also spread it around to the number of folks who are impacted. And I also think continuing to center race, and I want to just to speak as trying to be a white ally for a very long time, but so I want to speak to other folks, right? Ryan and incredible Black leadership across this city who are speaking to the systemic racism and the impacts in the homeless community. But there's incredible pressure at the federal level to stop talking about race, right?
Yeah.
We're not even 5 years after the murder of George Floyd,
Yeah.
and philanthropy's pulled away and folks are pulling away, and I just heard a few people say they're going to scrub their websites and change their language,
Yeah.
but they'll continue to do the work, right?
Yeah.
And so we know if we don't talk about it, we're not going to do anything about it. We know if we let other people not talk about it, that is how we've gotten in the place that we are now. So standing more firm in the face of a more sort of threat at the federal level is, I think, incredibly important, both to our city as a whole, but particularly housing and homelessness.
Can I say this too? I don't have a degree. I don't have a degree. I don't let people say, you're a person with lived experience. You're going to pay me like you pay everybody else. You know what I mean? Because it's expensive out here now.
Yeah.
Right. We got to look at those type of conspiracies too. We got to look at a lot of different stuff. In Los Angeles County. And it's so funny the way, contracts are written up, lawyers involved in the language you use and all this other stuff, all this crazy stuff that goes on behind doors. And it's a miracle that half of these agencies, or 90% of them, keep their employees employed. Because they're struggling to keep their employees employed with all of these deficits at the state level, federal level, county level. It's amazing that you guys are able to keep people employed to do their job. And a lot of people don't realize that. These organizations are not taking money and just messing it off. They're trying to keep their employees employed and housed too.
Yeah.
And fed too.
Yeah.
And then they're pushing behind the scenes to get more money. But there's all these regulatory things that happen behind closed doors, and money gets funneled this way, money gets funneled. There's no innovation funding no more coming down the pipeline. They basically tell you what you got to do with the money. And here are the rules. There's a lot of that going on too. Which is a headache. It has to be. I don't do it. I know about it, but it's a headache. It's a lot of that going on in social services. But these organizations are committed to helping people. So we got to give them a break. They're here to help us, help you, help us all. And a lot of people don't do social services and helping people because there ain't no money in it. Ain't nobody getting rich. Ain't nobody getting rich. They just doing it because of their background and what happened to them, and they doing it with a passion.
Right.
So if you see them out there, know that they're working because they probably been through something they damn selves. So we're all just trying to heal.
We're all just trying to heal. So I'm going to open up to questions from the audience.
Yeah.
You wanted to make? Yes?
Yes.
Okay, I'm going to go back from the grassroots and come from the doctor right here and go back to the projections upward. The reason why this is of interest to me, which it is a crisis, but I'm a property owner, and I get invites to affordable housing to give people a chance. I live in the Ladera community. It's an issue right now we're fighting because they want to put a 600-unit building right there with a route stairs and Sentinella right there. And the crux of, I find, of the hypocrisy is that they want to argue on the basis or the principle of, or they laid a foundation for justification for it to better the neighborhood. It's going to bring in affordable housing. Now, the affordable housing is going to be like $10,000 a month, excuse me. And they're going to offer, for the people that are homeless, or affordable housing, maybe 4 units. Okay? This is what I find, there's hypocrisy within the system. And so when you want to speak about Karen Bass, true enough. True that, so to say. But when you go through red tape in the hypocrisy with the bureaucracy, if they can change the zoning to the height limits, they want to keep it at 35 feet, okay, we're going to go ahead and go broader this way. Outside of that, there were no restrictions with the height limits. So I'm going to cut to the chase. If a new developer is coming in with 300 units, whatever, 150 units, whatever it is, shouldn't, it be a mandate in place as to if they're really speaking the truth for to address the issue of homelessness, shouldn't they allot so many units, say a 16th of the unit that they're going to go hit, a quarter? People would believe that. People would believe that, and that would be an impact, but they don't care. See, it's greed, and it's corporate greed. One developer isn't buying up everything in South Central. Gentrification and infrastructure is going on throughout the community, across the country. So there shouldn't be a homelessness problem. If you can go up, if you can look at the skyline, right at La Cienega, right around, what is that, where we catch the tram right there, right before we get to the Beverly Center. And regardless, if you have 20, 25 floors up there, now we talk about segregation, and we talk about disproportionate representation within the units right there, okay? Though the homeless people are being subsidized, because I have some of my units subsidized, they're still paying for where they stay. But the hypocrisy is that they don't want the people, or that gist, or that stench, or that stigma of having homeless people within these high-rises. That's an issue. And that's an issue that should be addressed in front of the city council. That's an issue that should be addressed with the city attorney. And that's where we stand. So I understand where you're coming from, because we're fighting the same issue over here in the other communities right here. How can you come in here and say you're going to offer affordable housing to whom?
Yeah.
Who could, what homeless person can afford $10,000, $15,000 a month? Okay, so if you look at that, it's bigger than where you are from the grassroots. It's starting from this way, back this way. My RSO fees, they get them every year, and they go up every year. Now there's the JCO fee right here, just in case you have to go have a no-fault eviction. The fee, so it's greed. If I'm paying RSO fees in 10, 12 units, imagine what the fees are, what they're filling the coffers on 150 or 300 units. It's not enough. It's not enough. So if they're going to go over here and be willing to sacrifice and give a quarter of their residency to the homelessness, well, that I would say would be something truly beneficial to your cause. I'm done. Thank you.
I'm no expert in this, but I've heard about the Analyst law in Los Angeles County. I'm no expert in this. I think Steve Lopez wrote an article where it says...
I can't hear you, sir. Sorry.
Steve Lopez wrote an article. He says it costs $500,000 to build one unit.
600,000.
To build one unit of...
This is a joke.
200,000.
A joke.
Yeah, in LA County. I don't know why it's so expensive. I've heard that
Kickbacks.
most units that go up in LA City and the county of Los Angeles, a certain amount are supposed to be subsidized for people only low income, but that's rarely happens.
Right.
I don't know what happens, but I know it happens.
Okay.
It's way beyond my scope, but I know it happens.
No, the gentleman just answered the question when he said, when the wealthy were impacted,
Yeah.
change will come about. See, it's flowing downstream, not upstream.
Well, I think once Palisades is built, it's going to stop. The red tape stops. It goes right back up.
Oh, for sure. It may not even apply anywhere else.
Yeah.
There's a moratorium on building and safety. I just closed the lease down on Fairfax Boulevard for business because there used to be a 4 to 6 month moratorium through building and safety to get permits. Now, since this disaster of January 6th, there's an infinite time period now.
Yep.
You understand that? Because they're going to be allocated first.
Well, I would
Okay.
say this. I live on the west side of Altadena, and my house was burnt down.
Yeah.
And every African American I know house was burnt down.
Right.
And what they don't talk about is insurance. Now here we go with the insurance.
Right.
Most of my friends, they live with their parents. They didn't have renter's insurance.
Yeah.
They didn't have homeowner's insurance. Damn. And these kids, they instantly homeless right now.
Right.
But we don't talk about how this impacted homelessness, right? We don't talk about that, right? We just don't talk about that in this community.
Yes.
I want to take a couple more questions.
Go ahead.
Like, this is a really good line of conversation, but maybe we can continue more afterwards because I'm seeing a lot of hands. I think this was.
Yeah, hi. Hi, I'm Sydney Rogers. First of all, thank you so much for the performances and for you all speaking your truth. I'm a program manager at the Los Angeles LGBT Center. I also am the equity lead there for community programs. I'm also a commissioner on the LGBTQ Commission for LA County. I was homeless between 2009 and 2013. I'm 11 years sober now. I've also done sex work. I've also been incarcerated, right? And when we talk about housing within the LGBTQ community, I know when I was homeless, going into shelters and stuff like that as a Black trans woman was not even an option, right? It was dangerous. They will put me in men's places. There were just no, that intersectionality, no one talks about. So in our community, housing is like on our list: youth, housing, healthcare, but housing is like our huge one, because even after our clients do get Section 8 vouchers, they show up, and if they're trans or not, or queer or not, they are automatically turned away, right? So even if they have their Section 8, they've done all the work, they've done all the system stuff, they're still discriminated against, right? So there's this frustration within our community of like, we're doing all the right things, we're signing all the papers, we're giving all the documentation, and we're still in danger of being houseless, right? And so I would love to hear any kind of like strategic stuff. I feel like we're like 3 steps behind everyone else doing the housing work, because we're still trying to like get people into we're trying to talk real talk about, if you do Section 8 stuff, this is what it looks like. You're not going to get keys the next day, boo-boo. It doesn't work like that. So how do we keep that real talk about intersectionality when it comes to housing? Thank you.
I would say this. I know the harm reduction division, we're going to open up our first drop-in center exclusively for sex workers. First one of its kind.
Congratulations.
First one of its
needed.
kind.
Much needed.
Amen.
And I'm so proud of that. She hit on some major stuff. It's going to be a drop-in center for sex workers, where they can get housing, health care, everything else they need. It's not for this big intersection, right? And I'm so happy that the county is moving that way. 'Cause that's part of that harm reduction stuff.
I have a question. I'm trying to figure out what, you guys, thank you so much for your work. Thank you for your ability to suit up and show up. Because I know after the pandemic happened, a lot of things changed, so much changed. I mean, you learned to have to do it all over again and deal with people's madness, and people had the right to be mad. People have a right to be hurt, sad, and frustrated, and scared. The thing about it, what I'm trying to understand with the senior citizens, nobody never really talk about that. I hear they say people, children, food. But you're talking about senior citizens that have lived their lives. How in the world do they expect them to pay thousands of dollars just to have a roof over their head? I see so many, and it breaks my heart to see the senior women, it's a lot of women's on the street, senior, carrying a cart in a doorway. Half of them have got on drugs, because there's no way in the world you can live on them streets without being on something and survive it, because it's crazy. But what are we doing? What are we doing? Are we actually really putting our foot down for the seniors? Because actually, you stop the grandmothers from taking care of the grandchildren. So that was a whole itself. You take care of your grandkids while the young kids could get a job or go to school to get an education, like you was talking about, the things that you and your mother had to go through. And I'm sure your mother was younger, but you're talking about the situation of a grandmother that has nowhere to go, no more soul food or any food. I'm talking about all races. No more of the smelling food for the youngsters or anything like that. Is people fighting for the seniors to at least get a decent place to live, affordable? I never hear anybody talking about it, and I see so many out there.
You wanna go ahead?
Well, I'll just say, thank you for talking about seniors. I mean, there's a number of populations we are not doing right by in housing. You mentioned LGBTQ plus folks. I think youth, by absolute, as a caretaker to a senior, my mother's now a senior, and I'm her caretaker. Like, this is a real issue. Number one, the aging population. Like, if you actually look at senior housing, the wait list is horrendous in Los Angeles. I know so many folks who have been waiting for years and years and years for seniors just to get a slot in senior housing, and they haven't been able to. We run a food pantry at St. Joseph Center, and the majority of the folks who come are seniors on fixed income, and we have seen that increase literally month over month over month since I've been there. We're not doing enough, I think, in my opinion, to really house seniors. We should have more of a conversation about what we should do, but particularly because we know, boomers are retiring and folks are looking for support, and I don't know if our systems are catching up to the need.
I would say this. Can you say this?
No?
When I walk Skid Row, I always ask people, what are you really looking at? And what I see is probably the biggest senior citizens community in the country.
Disabled senior citizens in wheelchairs.
Where these units are falling apart, there's nowhere to go. I go into the markets because there's no grocery stores around. The markets are charging people $4.50 for a can of chili. And these people are on wheelchairs and everything else sitting outside of these units. That's what's really going on in Skid Row, where this population is aging and social services is not keeping up with that. Remember I said something about appropriate housing earlier? I was kind of hitting towards that. I think Skid Row is the biggest senior citizen community in the country. And it's falling apart. There's no air conditioning in these units. They're gang infested. There's roaches everywhere.
Bed bugs.
Security is horrible.
None.
And if you walk on Skid Row and you see people sitting on Skid Row in wheelchairs like you seen this lady
No
walk
bathrooms.
out, I see that every day.
Nowhere to use the bathroom.
And we're not thinking about that as a social service organization. There's no money to keep these places up. They got money to build them, but they ain't got no money to keep them up. It ain't no money in supportive services. That's why you got one case manager for 30 people. And that's the stuff I was talking about behind the doors that they're trying to work on. There's no maintenance money to keep these units up and keep these units ADA compliant and everything. There ain't no money in that. The city's into putting them up, but not taking care of them.
Becky, you've been waiting to respond, and then I
just wanted to
see
say
one more.
something I think that reflects on a few of the things that I've said, which is, first of all, we all work in a system, even on the permanent housing side, which was designed to be a total, the smallest safety net for the biggest problems, right? It's never been funded appropriately. It's never been built appropriately, right? So all of the things that people are saying are about a housing market that is solely profit-driven and is incredibly discriminatory. And so we've continued to put all of our resources and policies into a market-driven system, like if we just build housing, everything will get better. And you can look at our own society 50 years ago, and any place in Europe and any place across the world in which there's a less of a homelessness problem and largely folks are housed in affordable housing, it is because it is government funded at a scale that is beyond anything that we have ever done here, and certainly since they defunded the public housing programs in the 80s and went to a private system. Section 8 vouchers are the epitome of that, right? And we have to use them, but they are terrible, right? They are fueling a market that will continue to discriminate against folks, will continue to evict certain groups of folks, and it'll be people who have been historically marginalized, historically discriminated against, or by nature have lower incomes, like seniors, folks with disabilities, right? And those incomes are kept low by our government systems too. So I just want, like, the questions that people are bringing up, and that is because we are in a system that, even with our big voter victories and things we've done, has nowhere near the resources that actual systems that support people have. And that's what makes the work frustrating, and that's what makes it way more frustrating, and quite frankly, you know, damaging and in some cases, you know, deadly to people, because that's the system that people think is set up to care for the amount of need, and it is nowhere near set up for that. And over relies on the private market for solutions.
I think second row has been waiting a really long time.
Yes, I just wanted to say, my name is Candace, and I'm part of the community. And I work very hard. I am on the west side. I'm in the Mar Vista area. And I just want to say that I've been involved in the community for at least over 20-something years. And we had a big problem. I'm almost sure Culver City and Venice may know the Sepulveda and the Venice overpass with the homeless. They've been there for, I think almost 10 years, but within the last 2 years, they got it cleaned up, and that was only because of the community. If you guys want something to happen, it really can happen. But you got to stay on no council and whoever else and carrying back. We were sending letters and we just didn't give up. And you go over there now, it's nobody under there. And picking back on what the gentleman down here was saying about the 150 to 300 units, I think it should be like 25%. They are being greedy and they are gouging. But I think if we stay strong and stay on top of them and send letters, it can really get done, because I am written, it did happen in my Vista. And just one more last thing. When you talk about property, and I did do a lot of research, and in my CD11 they did send me the information. It's a lot of city property out there that is empty, that's been empty for years, maybe 20 or 30 years. Why do you have to worry about buying expensive property when you know the property in LA is expensive? Why use what you have when you don't have to pay nothing but go in there, rehab, fix it up, and start getting a lot of those units filled up. That's all.
Actually, Karen Bass did try to initiate that. It's actually a program. You know, you can't make people. You can't set a mandate for that, but she definitely did push that initiative.
Before they used to have, well, if you live in, like if you build a unit, before, like if it's like 100 units or something like that or more, those city council, they made sure whoever bought or owned those buildings, they had to give, like, you know, back in the day, a percent. But I think a lot of them been getting a lot of kickback and stuff like that. This council been doing some hanky and we need to make sure we just keep our eyes open, right now, stay focused, stay on top of it.
Amen, that's right.
That's a thing called Ellis law. It's called Ellis law.
Converting, yeah.
So what they do is they put a gate around an empty lot. They have to leave it empty for a certain amount of time to get rid of the low income stuff on it. So they can build up. That's why you see empty lots.
Yeah.
Good afternoon, everybody.
Hi.
I have more of a comment because I am a housing navigator, case manager, and then for some years, as well, I started out volunteering and then as I got through school, eventually I came into my field. I've been on both sides. I've been homeless all my adult life until I turned 51, and then until now. There's a lot of things that a lot of people would like to say. It's not a cookie cut situation.
No.
It's never cookie cut. You have different ideas. There's different perspectives and ways that we can go after and allocate in order to try to make things work. It should never be just one idea. A lot of things that the gentleman said, Anthony, I'm listening to him. He has a heart. I have a heart. Sometimes if I say, and I believe I'm right, I know I'm right. God first. We've walked away from certain things, because I believe that only God can change the heart of man. Also, never staying a mindset, to hold on. We gotta care. You gotta have people to care. It takes a village.
Yes.
To work and make these things work, but we do have to hold our officials accountable. Don't let them just sit up in that office and put you on hold, knock on that door. Go with your, get neighbors, whoever you can kind of come up and hold them accountable to them seats. Or don't tell them, don't let your seat get warm because it's going to be cold. We have to do it. Then, I can say, and I want to say this because I work for St. Joseph Center under the leadership of Dr. Ryan Smith. And he, as I know, I've been around, I'm kicking senior. You see the hair, I don't dye it. It's not blonde, it's gray. Okay.
Always on point, though.
Always. He is one that cares. I believe when you, as well as any job, if you are an administrator and you do not, the best administrator is from one who comes from the bottom up. He checks on the staff as well as our population. He makes sure the staff is taken care of to the best of his ability. When we get better administrators that care, then you're going to see a better communal and a building of a strong community. And that goes in housing and everything. But don't put your trust so much in them as much as you have to put to me. I know you have to put your trust in God.
Yeah, and I'm conscious that it's getting late, so.
And I would say, Dr. Ryan, you are a unicorn in social services. And I know you know that, right? It ain't too many African American males at the top. I can count them on my maybe 3. So you are a unicorn. Thank you.
I know I see more hands. Let's see maybe one more question. One of you.
I have a question if I may jump in. My name is Teresa Y. Hillary. I heard someone talk about neighborhood council. Reimagining that system. How can the neighborhood council support what you are trying to do?
Good question.
How they could. Well, I do think there have been neighborhood councils who have been supportive.
The downtown Los Angeles neighborhood council, to be specific.
Well, that's a different one. Yeah, I haven't interacted with them in a while. But there are a handful of very well-known neighborhood councils who've been supportive on affordable housing and things like that. But I do think it's like about same thing, right? it depends on the composition of the council, but maybe people need to learn about the issue. Maybe people need to meet all the folks in this room. Maybe they need to pick a couple sites in their community that they care about, like, whether it's Dennison Globe or an empty city lot that could be housing or whatever, and focus in on those and really focus that advocacy, because it just is true that City Hall believes, and to some extent this is true, the people they hear from most, including neighborhood councils, are saying no to these things.
Yeah.
And they want to sort of avoid that controversy, and they want to avoid that conflict. So, doing the work, picking a project, picking a site, picking something that can bring people together so that people are getting to know each other and seeing some impact in their neighborhood. I mean, I think that's what changes people's minds, and then sort of you get bigger from the small, right?
Let's do the performance there. We need to do the performance for D-Leg. And then
D-Leg, yeah.
All right, well, thank you so much.
I'll have to speak up that time, because raising the hand doesn't work.
Oh, I didn't bring you up. I'm sorry.
It's okay, I just want